Today, we're trying to practice social distancing, just as we've been encouraging the rest of the community to do. I'm Erica Coghill. We wanted to offer an opportunity for reporters to ask some questions about COVID-19 as it pertains to Norton Healthcare. We're first going to open with President and CEO of Norton Healthcare, Russ Cox. He has some comments that he would like to make. We also have on hand Chief Medical Officer of Norton Healthcare, Dr. Steve Hester. He will also be available to ask questions. How the Q&A portion is going to work, if you'll notice this chat bar on the right side of your screen, if it's not yet generated, just hover over the bottom of your screen and click that chat icon. Submit your questions through that chat icon, and I will read those off after Russ finishes with his comments, and we will get started with those questions. We may not be able to get to all of those questions today, or during this Zoom meeting, I should say, but we will do our best to get to those at a later time. And then, of course, if you have any follow-up questions, be sure to send those to Maggie at maggie.rutger@nortonhealthcare.org. Okay, Russ, would you like to begin?
Thanks, Erica. Sure. Really appreciate you all joining in today. Thanks for being here. I know it's not lost on any of you that these are really unprecedented times for us in healthcare and in many ways such uncharted waters, but I'm going to forgo all that rhetoric and hopefully preserve the time that we can tell you some things that are going on at Norton Healthcare and answer any questions that you may have. But I would like to start with a bit of a message. I'm overwhelmed with the outpouring of support for caregivers that's come the way of Norton Healthcare by our community. I can't tell you the food, the balloons in front of the hospitals, the support has just been incredible, and it really does help our caregivers stay strong during this time, and it indicates just how much of a community that we are. I get asked the question constantly, what can I do to help? And today I have a very specific answer that I'd like to give. And simply put, it's to follow the admonition of Governor Beshear and Mayor Fisher and stay healthy at home. It absolutely is the best gift that you can give our caregivers. It's the best way that you can show your support for our caregivers is to follow those things that we talk about all the time. I know it's spring break week. I know that everybody would like to be somewhere else. And I know there's this temptation to go on a short trip or go out to the community and come back. And we ask you not to do that. We've made such great progress with containing our community, and we need to continue that. And by going away and coming back, it really does put our caregivers at risk. So it's very important that we follow those things. I cannot stress enough the importance of hand hygiene. What we know for sure about this virus is that it's very contact sensitive. It's very surface sensitive. It stays on surfaces for 6 to 7 days. So that hand washing regimen becomes so very important to us. Obviously, social distancing, can't say enough about this. 6 feet at least, but we know for certain that the more that we practice that, the better it's going to be for all of our caregivers. So we want to make sure you do that. And of course, I want to say, please be smart about this. It's so easy to revert back to old habits sometimes, and it will help us more than anything. It's the best gift that you can give our caregivers. We all need to remember that we want our caregivers treating patients. We don't want them to be the patients. That's so important for all of us. So it also, if we follow these things, it also helps us to conserve that personal protective equipment that we always talk about. The more that you practice those habits, the more that you prevent that spread, the better that we can conserve that personal protective equipment that is so important to us. So, one of the things that I want to make sure that you understand from me is that we're blessed in Louisville, Kentucky. We have an incredibly strong healthcare infrastructure. The DNA of the people who give care in our community is extremely strong, and our city's DNA has always been about supporting each other. And we're going to need to support our caregivers, and we're going to have great opportunities to support each other in all of these regards going forward. So with that, I'd like to move into to talk a little bit about what we're doing at Norton Healthcare and some of the numbers that we'd like to share with you. And I do a video every night that we make available to all 16,300 employees of Norton Healthcare, where we share information, where we bring them up to date on policy shifts, on policy changes, on things that we're trying to make sure that we stay ahead of this curve on. I think we're very fortunate at Norton Healthcare to have a great deal of data. It's an incumbent responsibility for us to use it the best we can to stay ahead of the curve, to try to predict where things are going and get there ahead of that time. And we're also in touch with other communities, finding out what's worked there, what hasn't worked there. But one of the things we try to do is be very transparent at all times with our employees about the specific numbers. So I'd like to walk through some of those with you this morning. So far in Norton Healthcare, we've had 127 patients who have tested positive for the COVID-19 virus. Right now, 34 of them are in our inpatient care. We have 19 patients at Norton Audubon Hospital. We have 7 patients at Norton Women's and Children's Hospital. We have 4 at Norton Hospital, and we have 4 at Norton Brownsboro Hospital. So far, since the beginning of this journey, we've tested 1,715 people. We're still waiting results of 754 of those tests. And that is something that's been very frustrating, but very understandable nationwide, the ability to quickly get back the results of those tests. These are not tests that are done within a hospital. They're not an immediate response test. They have to be sent to labs, and those labs, as you can expect, have been overrun for the past 2 weeks. But we're still awaiting results on 754 of those tests. So our numbers change every day based on the numbers of tests that we get back. As we've said before, we're being very, very daily transparent with our employees. As of last evening, we had 45 employees that had tested positive. We've tested 250 employees, so 45 of those have tested positive. We've centralized all of our resources around employee health and infection control in one location. We've brought all those resources together. They're there to work interdisciplinary with each other. The employee health line comes into this central control center that we have. So we've tried to do our best to help employees stay healthy and again, be the ones who are treating patients and not patients. So we've taken significant measures throughout this time to make sure that happens. One of those things that we've done is we've developed an app about a week and a half ago for employees to do a self-assessment before they come to work. It's a very simple 4 to 5 question self-assessment they can do on their phone. It requires them to ask themselves how they're feeling. Are they showing symptoms? And if they are showing symptoms, a screen pops up with a number for them to call the central command center, where employee health clinical people can have that discussion with them. Just after we started the self-assessment, we started doing temperature checks on all employees as they came to work. And if in fact they showed signs of a fever, we steered them towards employee health, didn't ask them to come to work. So we've taken a lot of steps to make sure that we're keeping people healthy and keeping people in touch with how they're feeling. Caregivers are very unique individuals. They work very hard at caring for other people and sometimes are so busy and so involved in doing that they don't necessarily look at themselves. So this app, the temperature checks, were meant to say, take a good look at yourself, let us take a good look at you. And as a result of doing those things, we have 282 employees who have been furloughed. Now, each one of those that have been furloughed are in daily contact with employee health. We're checking on them on a regular basis. Every case is individual, and we make certain that they do not return to work until they are deemed ready to return to work by themselves and by employee health. So that 282 number is representative not of people who have tested positive, but it is representative of those people who have shown symptoms, and it is representative of those people who might have had a fever during the testing coming in there. I want to make sure you understand that when you're furloughed, you're paid. It's absolutely not something where you're asked to go home and not going to be compensated for that. And we'll talk a little bit more about that as we go forward. So we have had over 50 who have been able to return to the workplace. That's a very good thing. We think that getting involved early with employees and having that centralized resource has really facilitated us helping people get back to work when they're ready and when they're able to get back to work. I want to talk a little bit about capacity because I know everyone is very concerned about capacity. We've seen it in other communities, and I think it's important that we inform you and we inform our employees on a regular basis about this. In all of the Norton healthcare system, we have available 1,174 acute care beds. Of that 1,174, 163 of those are ICU beds, or intensive care unit beds. And as you've read about COVID-19, there's been a trend towards many of these patients needing intensive care unit beds. So we pay very much attention to that number. We have 222 ventilators that are available. As of today, 80 of those are in use. We have the ability to convert some anesthesia machines over to ventilators that would take our capacity up to about 356. Now, I mentioned we have 1,174 beds available. We currently today have 550 people in those beds. Now, please don't hear that we have 550 people who are COVID in those beds. We don't. As we said, we have 34 of those 550 who are in our beds that are COVID positive, but we have patients with other situations, as you can expect, that we have in our hospital. So as of right now, from a capacity perspective, we feel very, very comfortable with where we are. We're trying to use our data and so much other data from people to project where that might be in the future. You hear the term surge capacity. As we try to predict, as we try to stay ahead of a curve here, we do have surge capacity plans. Within our facilities, we feel very comfortable that we could be at a capacity of 1,469 when the need arises, and if the need arises. We hope we're doing enough things to stem the tide that we won't be forced to use that surge capacity, but we're ready to do so if necessary. I'll also tell you, within that surge capacity, if we have need for more ICU beds, we are able to convert some of those medical surgical beds to ICU beds. So we're looking at predicting what that might look like and how we might do that, and we're ready to operationalize that at the time. Another statistic I want to make you aware of, that you know Norton Healthcare runs the COVID hotline for the state of Kentucky. We've taken 36,000 calls since about 2 weeks ago. We're averaging about 2,000 calls per day from people in the state on this line. And we're continually trying to find new and innovative ways to do things. And one of the things statistic I'll share with you that I think is really very good, not that they all are good, but this one speaks to where we're really using technology in a better way. We've been able to take about 700 telehealth visits that otherwise would have had patients in doctor's offices, that we've been able to stay complete with that patient, stay in communication with that patient via technology. So we're continuing to leverage that technology to stay with people during these times, and we think that it has made a difference. So Erica, with that, I'm gonna turn it over to you, and we'll be glad to take some questions.
Okay, great. And keep the questions coming, everyone. So our first question is from Grace Schneider. How many of those 45 employees testing positive are now hospitalized? And we'll let Dr. Hester take this question.
Yeah, thanks, Erica. And thanks again, everybody, for being here today. Actually, out of that 45, we do have one patient who's hospitalized currently.
And next question, I think this would be a good one for you, Dr. Hester, as well. How are Norton employees self-isolating?
So, one of the things, as Russ talked about, we created really an app that would allow folks to look at their symptoms and monitor on a daily basis. And so when we do work through that, we help folks decide if they do need to be furloughed. Those folks are self-isolating at home just as other individuals would who potentially had an exposure. So as Russ said, one of the big things we can do in the community to help stem the tide of this is certainly follow those suggestions by the governor and the mayor, because that really is a community opportunity for us to come together and really stop the spread by making sure that we're doing social isolation.
Russ, this question comes from Travis Ragsdale. Are employees having to use flex time while furloughed?
Absolutely not. We've entered into a covenant with our employees for at least the next 30 days where we've basically said, while volumes are down right now, while we're advising no elective surgeries, while we're also telling people not to come to the EDs, but to have phone conversations. We recognize volumes are down. Typically, health systems would be sending people home and forcing them to use flex time. We recognize that this is not the time to do that. We're going to need everybody on board when and if we do have that surge that everyone talks about. So we've told people, don't worry about that right now. If you're asked to go home, if you're asked to use flex time, we're not going to make you use your PTO. We're going to take care of that. You focus on staying healthy. You focus on being ready when we need you to come back and take care of patients. We're also trying to do that in such a way that if we don't have the need for a lot of people in the hospital or in the physician's offices or anywhere else, that we send them home, and that we then are better able to practice that social distancing that we talk about. And again, the best way for everybody to stay healthy is to make sure that when they're staying home, they also practice that with their family.
Does the 127 positive tests at Norton contain the 45 Norton employees who have tested positive?
Dr. Hester, I think that does. Is that correct?
That's correct. It does. And one of the things I just want to highlight on that, we've really prioritized testing for those folks that are inpatient as well as our employees, because we have an exposure. We want to be able to help those folks with that information. And so while testing is limited nationally, this does present challenges, but to look at those numbers and say that there are 45 of the 127 are employees, you have to take that in context that we aren't broadly testing the community. And so I think that those numbers are in there, but they don't represent what we would see in a community typically if we were testing a lot of outpatients.
Okay, and we have a question from Chris Otts with WDRB. I'm told that the Norton employees who staffed frontline patient screening stations at your hospitals were initially instructed not to wear PPE, masks and gloves, for about the first 5 days in mid-March. I'm also told that the staff screenings did not begin until March 25th. Is this true? And if so, did these policies contribute to the 45 employees who have tested positive?
So I'll take that. And first, absolutely, that's not true. When we started those screening processes, we really were doing that to be proactive, so that when folks were coming in, we were doing temperature checks on employees and visitors. Those individuals did have the proper PPE and instruction to use it. That was a key part of that initiative. As it relates to when those started, just as Russ had said from the daily videos, they started really early on about communication in this process early in March. And we really talked a lot with our employees about self-monitoring. What may have been a reference to something that we did in terms of an app that we put out that allowed them to sort of have that information in front of them by phone. But we were constantly messaging the importance of that self-monitoring for symptoms. And so I don't think any of those things had any impact on the number of patients that are employees that were positive. But again, I want to highlight that we have 16,000 plus employees. And so when you look at that, we're going to have positives just from community spread. Whether or not they're healthcare workers or not, you see this in the community. So 45 out of that 16,000 really represents those, again, the limited number that we've tested. And I don't think those policies had any contribution to that. In fact, I think it helped us on an awareness, because I think our folks who came forward and said, I have symptoms, were then allowed to be tested, and we started to monitor them.
Jonathan Gregg is asking if the employees who tested positive are clinical employees.
I think there are a variety of employees across the system, some clinical and non-clinical. So again, just to that basic piece, that those would be of the 16,000 employees, we're going to see a variety of folks who unfortunately test positive.
Are facilities now short-staffed to care for COVID or non-COVID patients?
Erica, not in any way. As I mentioned earlier, we've been very compliant with the cessation of elective surgeries. We've ended all elective sorts of diagnostic procedures. We've instructed people that it's not the place to come to the emergency room unless you have specific symptoms. So we have volumes that have really gone down. We are ready. We are well staffed. Now, we also know that we can't predict the future, and we don't know what that means going forward. So we want to make sure that we continue to look at that, but we are in good shape right now.
Are there more than 45 Norton employees self-isolating?
Steve, I'll let you answer this, but I believe when you go on furlough, that's a form of self-isolation. So I'll let you take that.
Sure, there are 282 currently on furlough. And again, those may have been that they had a potential exposure to an asymptomatic patient that came in that then became positive and out of caution have sent those folks home. Or they may be folks that are exhibiting symptoms. So again, very robust process that we have in place to make sure that we're monitoring those individuals on a daily basis and working with our employee health team to make sure we have a safe environment for our caregivers.
Dr. Hester, Jacob Ryan asks, in what areas of hospitals are COVID positive patients being treated? I know we need to protect our patients and their identities and where specifically they're being treated, but I think he's getting at, how are they being treated to protect the spread of the virus is what I would assume.
Yeah, absolutely. So one of the things that we're doing, not unlike other health systems, but we're cohorting those patients into units. And what it allows us to do is make sure that when folks are rounding, they have the proper PPE in terms of the way they use it, going from room to room, knowledge there for those positive patients. From a unit standpoint, obviously in an ICU, we're designating certain areas of that for those positive or suspected positive patients. And so it allows us to have a more effective rounding process for our team and better to manage the proper equipment for protection.
Dennis, I'm not sure of your last name, Dennis. He asks, are nurses and other healthcare workers using proper masks and PPE?
Absolutely. And so one of the things for all staff have access to the PPE, all staff are using the PPE. And one of the things I want to talk a little bit about is yesterday we initiated a policy where we're doing universal masks for all of our clinical staff. We moved this forward because we were seeing patients in the community. As this spread has continued to increase in the community, we're seeing more and more asymptomatic patients come to the hospital for other conditions. But the concern is that they may very well be sharing the virus. And so in that sense, we moved to universal masks for our healthcare providers and staff. And so that's going to allow us, we think, to again, protect the community better, as well as continue to protect our caregivers.
Are nurses working in labor and delivery also working with COVID patients during the same shift? If so, are there any changes before they switch between patients?
Absolutely. We treat those patients just as we would any other isolation patient. You know, one of the things from a healthcare perspective is obviously this brings to the forefront a lot of infectious disease cases, but we've been taking care of infectious diseases for many years. TB patients, all the things that you'd think about. Chickenpox, those things come through our health systems on a regular basis all across America, and we've been prepared to do that. And so, not unlike that, we have policies in place when taking care of patients who are potentially positive or positive to manage them effectively. So our teams do have the proper equipment and policies in place for those patients.
Grace Schneider asks, we've been told that 7 doctors and nurses tested positive at one of your facilities. What can you tell us about this situation and how the health system is increasing measures at the same place? We're told docs are in papers versus pappers versus nurses in surgical masks.
So first, I'll take the question. We have, as I said earlier, we have had all types of providers and clinicians and non-clinical folks test positive. When you look at that across the system, it's not unlike our representation of the rest of the community. As it relates to those specific individuals and the type of PPE that's required, one of the things we've really focused on is what PPE is required for that task. So one of the key parts of that is it's task-based. It's not based on your role as a doctor, as a nurse, or whatever it is. Whatever task you're doing, we base the proper PPE, and that follows the CDC guidelines. So I think that's a consistent message that we're constantly putting out. And I think it does the best things to help us care for patients and protect our employees.
What is the process for the test? Where is the bottleneck? Where did the test go?
Well, I think early on, one of the challenges was based on the limitation of both test kits and testing sites. So that was the national challenge, and it was one that was not just us locally. Initially, when we were doing tests, we were sending those to private labs, and the private labs were quickly overwhelmed. And because of that overwhelming response, some of those results were delayed 6, 7, 8 days. And that's why I think that you're seeing a tremendous message that's come out to say that if you really are not needing healthcare services and you test positive, to stay at home because that needs to be managed at home. And especially if you're getting symptoms at this time, it is likelihood that you have COVID and you need to be just manage your symptoms. And if you need healthcare, seek it.
What is the process for I'm sorry, I just read that one. Where specifically did COVID positive employees work?
All across our health system. Again, just as we had said earlier, there's not one single location.
Yeah, and Erica, let me also say that be assured that our employee health, our centralized employee health function is working with each one of those employees, and we're working going back as to where they were and how they were involved. So we're very much all over that. And as you can imagine too, we want to make sure that we respect their privacy and work with them to get this information and help.
And this question is from Chris Larson. Is Norton missing financial projections by putting off elective procedures? A lot of the organization's revenue comes from outpatient.
I'm going to be honest with you. Financial anything at this point is of such a secondary nature. I don't mean to sound flippant about it, but we're 100% focused on employees, keeping them safe and patients and getting ready for this. We trust this community. This community's trusted us for many years, over 150 years. And once we're through this, and we will get through this, we think that employees who had those elective procedures postponed will come back to us, and we think that we'll be fine. We've always exhibited a flexibility and a resiliency from a financial perspective, and I have every confidence that we're going to be fine.
To follow up with that question, do low volumes because of put off elective procedures mean there is not a need for expanding workforce, or will Norton need to hire more to deal with this?
Well, we have not stopped the hiring process. We feel that it's very important that, just as an example, as we try to stay ahead of this curve, we're looking at the fact that in other markets, and what our data tells us, that most of these patients, or a lot of these patients, require ICU care. So we know for sure that we're going to be able to, or we're going to want to transition some of those medical surgical beds into ICU beds. And we need to make sure that we have staff that can care for those patients in that ICU level of care. So we're continuing recruiting in healthcare. We're always recruiting clinical people. We're always trying to keep the pipeline open, and that's not stopped. We're continuing to do that.
Where specifically, well, we've already addressed that question. Is it true that clinicians and other staff have been asked to donate PTO to deal with the crisis?
I can answer that, Erica. Employees who work in healthcare are very caring and giving people. Early on, we had people requesting from us, hey, I know that people may be affected by this, and I know that there may be people who will need help. Can I donate some of my PTO to help these people? Absolutely, the answer was yes. I think we've taken care of that situation by telling all employees that during this next 30 days, you need not worry about how things are going to impact your paycheck. If you're asked to go home, you're going to be paid. You're not going to have to use your PTO. All of those situations we're trying to alleviate. Eric, I do want to go back. I may have said when I answered a question a minute ago that we were very certain employees would come back. We are certain that employees will come back after this is over. What I meant to say was we're certain that patients will come back, because obviously there's been a lot of elective procedures that have been postponed. I just want to clarify. We're very confident that employees will stay with us through all of this. We're also confident that patients will come back when this is all done.
Is Norton Healthcare conducting tracking to determine if the Norton employees who tested positive contracted through direct contact or at work or outside of Norton facilities, community spread?
We do. So, each of those patients who present with symptoms or we find a positive, we look to see if that patient was in isolation when they came to the facility. We track those and then look and see if there are exposures. Then we may send those folks home or monitor for symptoms. So it depends on the type of exposure.
For how long are clinical staff having to use masks?
So meaning, I'm assuming that question relates to sort of the extended wear and use of PPE. If that's that question, it relates to, for instance, the CDC put out guidelines on extended use and reuse of masks. So we're following each of those guidelines in that regard, and I think those are pretty consistent from a national basis.
How many employees do we anticipate will ultimately be infected? What is the threshold for number of infected employees that hospitals can continue to operate with before staff shortages impact care?
We absolutely hope no more. From that standpoint, I mean, our goal is for none of our employees to be infected. And certainly, one of the things that I can tell you, I couldn't be more proud of our employees and staff, because they come in every day making sure they're taking great care of this community. And certainly one of the things that from that standpoint, we want to make sure, and we believe we are providing them the best ability to protect themselves. And so certainly we hope no more. And we want to make sure that we're doing the right things to protect them. And we constantly look at that on a daily basis.
This question is from Chris Otts. We are working to get updated numbers from Baptist and U of L Health, but what should we make of the fact that apparently you have many more COVID-19 cases among employees than those systems do? Is it merely a function of size of employee base?
Well, obviously we have 5 hospitals in this community. We have probably, I'm not sure the exact number, we'll get that for you, of physicians' offices. So I can't comment on their numbers, but certainly when you look at an organization that has that many hospitals, that many physicians' offices, and when you look at the fact that 57% of the community is entrusted with their care, it's going to make sense that number is going to correspond.
Okay. Well, thank you very much. And we're going to have to wrap now. That's all the time we have today. But thank you all so much for joining. If you have any additional questions, or if we were not able to get to your questions within the time we had allotted today, please be sure to follow up and email Maggie at maggie.rutger@nortonhealthcare.org. And we will do our best to get those to you, those responses to you in a timely manner.
Erica, I'm sorry. Can you hear me? I just had the one more question there about the specific breakdown of where the employees tested positive. Could we get that? I may have missed that in the answer.
I will have Maggie work on getting a response to you so we can get those numbers.
Well, Mr. Hester, if you're there, is that something you can provide?
I don't have those numbers in front of me. And one of the things, certainly one of the things there I would say is in my answer, I felt like one of the things I'd said was they are across the system again, non-clinical and non-clinical employees. And so certainly we want to make sure that we're protecting our employees. And so they're very varied places across the system.
Do you feel like, I guess,
we've got to wrap this. I'm sorry. They have a meeting that they need to run to. If you have any additional questions, we will have Maggie and the rest of the PR team work on getting you those answers. We want to make sure we are able to put our heads together and get you some accurate information. So thank you all for your time. We do appreciate it. Everyone have a great day. Thanks.